Tonight we come to you with a tragic story from the Middleton Memorial Hospital. The 2-year-old Emily Jerry was pronounced dead after a pharmacist tech administered the wrong medication during her last chemotherapy treatment. Tonight we are going to be asking the Chief Nursing Officer some questions. But first, here is a quick segment on the medication administration and safety from the State Board of Nursing.
Thank you, Kenzie. So today we're going to be looking at medication administration and safety. So what is a medication error? It's when a patient is harmed while the medication is in the hands of a healthcare professional or a nurse. And almost all of the time, these can be prevented. And who is in charge of the medication error? So most of the time it's the nurse, because we're the ones administering the med. So it's our job to check and make sure it's the right medication, right dose, all the right things. Sometimes it can be the physician's fault, but back to us again, it's our responsibility to check the order and question the orders if we have any questions about them. So how can we ensure that medication's administered right? We have 7 rights here. We need to check and make sure it's the right person, patient identifiers, date of birth, and name. Medication, dose, right time, right route, right reason, and right documentation. These are all important so we can make sure that the medication is prepared right and administered effectively or the right way. So what are some risk factors for medication error? One would be inexperienced staff. So if you're young or you're a new grad, or sometimes when patient population is high and staff is low, people who aren't even supposed to be administering meds might jump in this role. And then a challenging patient population, so young children, hospice. If the nurses created a strong connection with a particular patient, it might be difficult and you might do things that aren't right. And most importantly, most commonly, is the wrong dose and right medication. If you don't have the right medication or the right dose, some people might try to compensate by giving a higher dose of another medication or even a lower dose, and it never ends up good. And the nurse's role to prevent medication error, we need to clarify the medication, and we do this by performing our 7 rights. And we also need to check allergies and contraindications for the medication. So we need to be prepared if something does happen when this medication is administered to assess the patient. And how can we reduce medication errors? We need to acknowledge that they happen. They're not something that need to be shoved in a folder and shoved in a case file. We need to acknowledge that they happen and figure out why we need to make this change. So obviously we want to ensure all of our patients and make sure they're safe in our facility. And we need to work as a team and talk as frequently as possible. It's important that everyone has the same idea and we all want the same outcome. And most importantly, check your drug label. Make sure you know what the medication is, why it's being given, and why that specific patient needs that drug.
Now that we know how medication administration is supposed to work, let's discuss with the Chief Nursing Officer from Middleton Memorial about the events leading up to the medication error. What is the procedure when a medication error occurs?
Okay, so whenever a medication occurs, the very first thing we want to do is assess the patient for any adverse effects of the medication that was administered. So we would look at their vital signs, and then we would notify the provider, and then also fill out an incident report.
Thank you. How is your facility comforting the technician that made the mistake?
So my facility, we are comforting the technician by watching for any signs of physical or psychological deterioration. And also we are making sure to manage any rumors that may occur and keep them kind of at bay.
Can you provide information on the medication that was used and how it led to her death?
Yes, so Emily was supposed to be getting 0.9% sodium chloride on her last chemotherapy treatment. And so the facility ran out of 0.9% sodium chloride, and the pharmacy technician combined 3 to 4 vials of that solution that equaled 23%, and it made it a hypertonic solution, which is an extreme overdose and sadly resulted in Emily's death.
How could the nurse ensure patient safety before and or after the event occurred?
So before administering medications, like Mallory said, we want to ensure our 7 rights. And then after the error occurred, our priority would be to assess the patient right then and there, notify and fill out an incident report. And if there was a way to reverse this error, we could implement those steps.
I know we talked about it a little bit, but how exactly did the error occur? Like, what were the chain of events?
So Emily Jerry was diagnosed with cancer in 2006. She had a grapefruit-sized tumor in her abdomen. She underwent chemotherapy, and on her last MRI scan, there were no signs of the tumor or any residual scar tissue. But to ensure that all the cancer cells were gone, a 3-day chemotherapy session was ordered. And on her 3rd day of the treatment, Emily was pronounced dead due to the medication error. Our facility ran out of 0.9% sodium chloride solution, which is an isotonic solution used for the base of chemotherapy. The tech used 3 to 4 vials placed in a bag in replacement for the normal solution needed. And this extreme hypertonic solution led to the child being pronounced brain dead after examination.
Why was this medication classified as an error?
It was classified as an error because it was the wrong dose and the wrong medication was administered to the child as the base for her chemotherapy treatment. The father came in 15 minutes after the chemo had been started, and Emily was unconscious, so we can assume that she was also not being observed properly as well.
Thank you. Well, thank you for coming in and providing us some information on this topic.